come as no surprise to you that I intend to dwell on health and social care issues as they will relate to my constituents in my own country of Scotland. But before I do so, I should like to remind the House that just because edicts and statements are issued from the benches opposite does not mean to say that they are factually correct. Indeed, I must say that the pejorative language used by members opposite, including those representing Scottish seats, when discussing Scotland and its SNP government, is unjust, mostly fallacious, and paints a picture of healthcare in Scotland that neither I, my family, nor my constituents recognise. In Scotland, the SNP government is carrying on with the day job and has abolished prescription charges, which help many folk in Scotland. And to know that your medication you need you can have without worry is a fine thing. And it can save precious NHS resources further down the line. Madam Deputy Speaker, satisfaction with the NHS in Scotland remains high. 95% of patients rated their overall experience of cancer care positively in 2018. You may shake your head, sir, the member opposite. I can vouch for that, as my own husband had cancer treatment in Scotland. 86% of people rated their full inpatient experience positively, and 83% of people rated the overall care provided by their GP surgery as good or excellent. Scotland's patient safety record is among the best in the world. Over the last 5 years, there has been a decreasing year-on-year trend in the rate of both MRSA and C. diff infection. Scotland led the UK by introducing a mental health waiting times target, and the Scottish Government's 2019-20 programme, the budget for mental health increased by £15.3 million, up nearly 22%. This is the first government in Scotland to have a ministerial post dedicated to mental health. The SNP is always looking to improve services for all Scots, which is why the government is undertaking a review of mental health legislation in Scotland. This review aims to improve the rights and protections of persons who may be subject to existing legislation and remove barriers to those caring for their health and welfare. This Tory government hopes to emulate Scotland in abolishing parking charges at hospitals. And since 2008, when the SNP Scottish Government abolished car parking charges at NHS car parks, patients, visitors and staff have saved over £39 million. The Nuffield Trust, an independent health think tank, has said that although the 3.2% increase in NHS England's budget is welcome, it must not detract from the reality that the English health service cannot adequately function or improve without significant investment in NHS capital and workforce. Perhaps NHS England, through adequate government funding, could emulate NHS Scotland and could offer the same bursary to student nurses as they do in Scotland, where from next September nursing students will benefit from a £10,000 bursary, double the proposal for those nurses training in England. And of course, nursing students receive free tuition in Scotland. The benefits of this policy is easy to see, with nursing student numbers in Scotland increasing for 7 years in a row. Compare that to a 30% drop in applications in England. How difficult will it be for this government to achieve their promise of 50,000, or is it actually 13,000? 19,000 fewer nurses? I'm not sure. I'm a bit confused about that figure. Perhaps I'm not the only one. On the question of social care, in Scotland in 2011, the Scottish Government became the first in the UK to pay the real living wage to staff, including all NHS workers. In 2002, free personal care for the elderly was introduced by the Labour Lib Dem executive, and I pay credit to them for that. But this was against the wishes of the Westminster parties, who used it to cut social security funding to older people in Scotland. As ever, Westminster never misses an opportunity to cut Scotland's budget. Now the SNP in government has extended free personal care to all those under 65 who need it. And from the next Parliament, the Scottish Government will work to abolish social care charges.
Order! The Honourable Lady must be heard. There are indeed a lot of people here this afternoon. No noise. Marion Fellows.
Thank you, Madam Deputy Speaker. And from the next Parliament, the Scottish Government will work to abolish social care charges. The Westminster Government would do well to look at and emulate many of the forward-looking, fair, equitable and progressive policies which originate in Scotland. One example of this is that everyone who uses social care services can now control their individual care budget through the Self-Directed Support Act. The Prime Minister promised to fix the crisis in social care once and for all, with a clear plan we have prepared, he said. The UK Government have failed to propose a bill, a clear timetable or costings in their manifesto to address the social care crisis in England. The Tories have been in government for a decade and overseen the social care crisis. According to Age UK, there has been £160 million cut in public spending on older people's care in the last 5 years, despite rapidly rising demand. About 1.2 million people over the age of 65 did not receive the care support they needed, and cuts have increased the pressure on unpaid carers. In conclusion, Madam Deputy Speaker, I encourage the Secretary of State to look to and adopt the innovative measures which the Scottish Government has introduced in Scotland to the benefit of those who live in England and use its NHS and social care provision.
I'm